Hey, it's Chris Beyer.
Chris Bowling.
Welcome, Brad
Brad
Johnson, to
Johnson.
another Bottom Line Thursday. We're trying to be more formal.
Thank you
Trying to
very
be more
much.
formal. So
Yes.
had a
Yes.
topic today to bring up. We have seen, as we're recording this latter part of April, now that I look at my calendar, public health emergency, national emergency are expiring in May. But I feel like we keep seeing different dates pushed out there and lots of change to that. Can you help us make that simple? What's actually going on, and why does an employer care about these revised dates and what's actually taking place now?
Yeah, I think let's just keep it real simple. I think there's some technical aspects that a lot of the policy experts are really diving into and want to be the first to clarify some of these things. But, Biden signed off that these things are coming to an end, thankfully. COVID is maybe, knock on wood, getting behind us. There's kind of two things to keep in mind. The first one is this public health emergency coming to an end. That impacted benefit plans when you think about like testing. So there was that requirement that plans had to cover testing free of charge, even covering over the counter tests. Like if you bought it at a Walgreens or Walmart or whatnot, it had to cover those things. And then obviously the COVID vaccine. I think the key takeaway on that one is that on May 11th, those things are going to revert back to what they were prior to COVID. Well, candidly, some of those tests didn't exist prior to COVID, but so your health plan still has to cover a test if you have a COVID, or if you do a COVID test, but it no longer has to cover over-the-counter tests, which is kind of an interesting thing. And then finally, the vaccine will still be covered in full as preventive. I think those are the key takeaways on that one.
That's easy.
No, I think it's simple. I know our compliance regulatory team are keeping tabs on how things change if something else comes out. But just like you said, it's getting us back to what would be undoing the COVID things that were there and making COVID vaccines part of wellness as a flu shot is. I think that's as simple as you can make it.
Yeah, and I think what's causing the flurry of emails that everyone's seeing on their HR newsletters and whatnot, I think it's just they're trying to determine what exact date is it, the 11th or the 12th. There's kind of some back and forth, but at the end of the day, that's the same message applies. And then the only other exception to this is the national health emergency triggered some other dates to expire, and that won't happen until mid-June. And that has to do with the fact that employees could, or former employees could, retroactively elect COBRA, longer than normal guidelines, make retroactive changes to their plan because of a HIPAA qualifying event. It really just gave people more time to do things.
Sure.
But it didn't change the fact that they still owed the money if they wanted to go back in time and change those elections. I think for most folks, kind of a nothing burger, but you're seeing a lot of activity on it. I think the first part we chatted about on this is the most important. Just no plans are still going to cover a lot of these things, but no longer paid in full at 100%, except for over-the-counter tests. They're now on you. The government still has a small supply, I've heard, on their website.
Yeah,
if you want to,
that works for me. Nice and simple.
A free one.
I can tell you the first time I did that, Brad, when I went to Hy-Vee, they had a row of them. I mean, literally, I was in and out of there in 5 seconds. I got my 5 tests, and man, I went in there maybe 3 or 4 months ago, and they were searching for the bag. So, obviously we're not having to test as much as we used to in the past. So I think it's all welcome to news.
So that works.
Yeah. So
that's the bottom line.
That's emails, just remember it. Yeah, that's it.
Well done, Brad. Thank you for
thank you.
Yes, for definitely helping us through that process.
All right. See you next time.
Enjoy your day.
All right, thanks.
We'll see you guys. Bye-bye.